Now I remember going down to the ER. They had somebody, I believe from the 5th floor, come down, started going through my symptoms with me, and they're like, yeah, you got COVID. And that's when they asked my wife to leave and told her to quarantine herself, and they admitted me up to 5th floor pretty fast.
It was one of those shifts where you sit there and you watch him and you hope for the best, and you call the family, and
It was a fever I couldn't get rid of, and then I'd get into a coughing spell. I couldn't breathe.
He was extremely sick. We were putting him on his belly, we were doing dialysis, we were doing everything we could to save this guy.
Courtney Harmon, she was one I believe who was in very close contact with my wife throughout the whole thing. I think she was the one that possibly set up the first FaceTime video. Gave them guys the opportunity to actually see me and see what was going on.
I was able to take FaceTime in and have them see dialysis running, him on his back finally after we had flipped him from his belly. And that was one of the best moments that I had taking care of him, because I was able to connect the dots for them, have them be able to see what it was like in the intensive care unit, especially for COVID patients, and what it was like for Chad. I think it really put everything together for them.
I can't imagine what they went through, having a dad and a husband in the hospital, not knowing what's going to happen and no contact. The initial call of me calling her at 1:30 in the morning and telling her goodbye, was going on a ventilator, that was tough. You don't know how you hope you're going to wake up, you hope everything's going to be okay, but at that point, you really don't know.
We had no idea how hard it was going to be to isolate these people, isolate ourselves from even our own family members, and then to go in day after day and put on new scrubs and go into this plastic tube to take care of these people was just intense, and they were some of the sickest patients I have taken care of in my 3 years as a crit care nurse.
The week before I went into rehab, I couldn't even stand up and walk more than sometimes I couldn't walk any steps. It was just scary.
The day that Chad got released, so from our perspective of the intensive care unit, we had him when he was essentially bedridden and not able to do much of anything, and to see him grow and progress to the point of being able to walk out of this hospital just proves how great our care truly is. From MICU to the 5 East floor all the way to rehab, we took excellent care of this patient, and he was able to walk out of here, and that was tremendously amazing to see.
When I walked out of my room at St. Luke's and just seeing all the support with all the nurses and doctors and staff as I walked through the halls, and they were lined up from my room the entire way to the front door. And then seeing all the friends and family and friends of family out there to support me when I got outside, my feeling was just overwhelming. Then finally seeing my daughter for the first time.
The thing that stands out to me is when Chad was discharged through A Avenue, that was awesome.
I'll remember vividly, he went outside, and when those motorcycles all revved up and your chest just went, and that was like an amazing feeling too. It was just invigorating.
UnityPoint St. Luke's, it's a great place to go. I was very pleased with the care. I was very pleased with the way they handled everything. Post-hospital, same way. Just trying to get all the doctor's appointments and things lined up and making sure you're getting the right care, and they've done a fantastic job. Physical therapy floor, the rehab floor, working, trying to get me stronger. This experience has really made me appreciate my life every day.
Some people are heroes, other people are superheroes, and they were superheroes.
Nobody was saying, how do we do that? I don't think that will work. It was like, we can do that. We're gonna do it. We'll have it done tomorrow.
Always have in mind that there may need to be a plan B, that this plan A might not be accurate.
We knew that it could change at any time, so making sure we were taking that next step, we were making quick decisions. You were making decisions with limited information in a lot of cases, and through a crisis like that, it's what you need to do. Get these units ready, make sure that we're one step ahead of that next patient coming in.
You know, it was just amazing how fast we had to flip a switch. Our complete model of care was flipped overnight. Now we want to really provide a very safe environment and transform to telephonic visits, virtual visits, and then, you know, just creating a really safe environment so we could clearly delineate people that could be COVID positive or not.
Doubling our bed capacity was really a high point, I think, of this, because you don't double your critical care beds overnight, and it felt like we did it overnight because it happened very quickly. And not only did we have to just double beds, we had to make beds negative pressure, which was another obstacle out there. But the team putting that together and everybody just putting their thought process together between the nursing staff and plant operations and IT and biomed, it was actually amazing to watch that all happen.
We really came together as an entire unit. There were several nurses that volunteered to go up to MICU, which was our COVID intensive care unit, and really work became more of a release. If you asked any of those nurses, they would say, I'm happy to be at work right now. This is where I need to be because I'm not worried when I'm at work. I worry when I go home.
The first weekend I worked when this pandemic started, the anxiety was through the roof. You could feel the anxiety with every staff member, from housekeeping to dietary to nurses and providers. Here at St. Luke's, we have an amazing employee assistance program and behavioral health workers that came to our department and rounded with our team members.
Carol Mead and her team with behavioral health and counseling services and the support teams that have put together resources for our team members to debrief and be supported and be able to talk about these kinds of things that are occurring. It's so different than anything we've ever encountered before.
Hats off, obviously, to our team. Team members were pulled from their comfort zone. I've always worked on this unit. I've always taken care of orthopedic patients. Well, our surgeries have backed off quite a bit. We don't have a need for that orthopedic nurse, for example. She's then being cross-trained into our ER, into the COVID units on 5 East and otherwise. So a lot of credit to that labor pool, and specifically the trainers that were cross-training resources to get them ready to pull into different units.
One lesson learned, or one thing that I'm just constantly reminded is how lucky we are to have the kinds of people that work at St. Luke's and Jones Regional and UnityPoint Clinic and Abbey Health and all of the parts of our organization. We're so fortunate as a community to have people who will put themselves at risk, who will set everything aside, who will care for others without judgment to make a difference for one patient at a time and for our community as a whole.
I was so grateful to see them recognized, every single person in the organization to be recognized for the work they're doing, that the community was bringing in food and celebrating them as heroes, because they are.
My biggest takeaway from this is that I have an amazing staff of physicians, an amazing staff of nurses and therapists, and I practice medicine in an amazing community.
When you have your loved one admitted to ICU or to anywhere at St. Luke's, you can guarantee that they're going to be taken care of absolutely to our 100% best, and COVID did not impact that.
I think the coronavirus didn't break our healthcare system. I think the coronavirus just exposed how much more potential we have as a healthcare system.
When we are able to focus as a system on a single goal, we can be extremely efficient and provide great outcomes.
We're forever grateful. You did everything that you needed to do. You came to the front every single day to take care of our patients, to take care of one another, to take care of this community. We can't thank you enough.